The thing is, people always ask me, like, what's the one thing I should do? There is no one thing. The one thing is sunblock, probably, if there's a one thing. Really depends on how old you are, your skin quality, your facial structure, your budget, your comfort level with trying new things. Like, there's so many variables.
Should we be eating all organic?
I'm sure that people in my wellness world want to hang me for this, but I think that the jury is still out.
I'm so glad you brought up sexual health, because I think that is such a topic that women don't feel comfortable talking about.
All the things that are in your head, because we know that your brain is your largest and most important sex organ. So you start with there. So start with the mind.
What are the signs that women should look for to see if their hormones are off?
All women should be getting basic hormone testing at least once a year. And that's like thyroid. That's, if you're over 35 or so, probably testosterone. Yeah, unfortunately, doctors just don't receive training or, very much training at all in any of this stuff. Even the gynecologist, even the endocrinologist. Consistency. You don't have to go hard every day. You just got to go.
Today's guest is one of the boldest, smartest, and most forward-thinking voices in women's health and regenerative medicine. Dr. Amy Killen is a board-certified physician and expert in anti-aging, hormone optimization, aesthetics, and sexual wellness. And she's not afraid to talk about the stuff most doctors avoid. In this episode, we break down the science behind midlife aging, from hormones and libido to peptides, PRP, and exosomes. We talk about what actually works, what's just clever marketing, and how to advocate for your body when the system keeps telling you you're fine. We also go deep on why so many women are misdiagnosed or ignored, what's really driving low energy, low sex drive, and accelerated aging, and how regenerative medicine is rewriting what's possible for women in midlife and beyond. This conversation is smart, grounded, and packed with information you're not getting from your average doctor or your For You page. Follow the Iconic Midlife wherever you get your podcasts, and send this one to the friend who's wondering if it's just hormones or something deeper. Amy, welcome to the Iconic Midlife. So excited to have you today. Thank you so much for joining us.
Yeah, thanks for having me. I'm excited to be here.
Great. How's your day going so far?
It's been busy already. I was up early today, so it's good.
I saw you were at a lake, I think, yesterday. Is that right? You were traveling?
Oh, yeah. I was. It's like an hour from my house, so it wasn't that big of a travel. But yeah, we go there every year. It's amazing.
Oh, that sounds so refreshing and so nice right now. I could use a lake. I'm in Texas right now. It's a little hot.
Texas is hot.
It is, particularly in August.
Yep.
Amazing. So I would love to dive right in. I opened up my DMs to my followers, and the amount of questions that we got blew my mind. There's so many things to discuss. I feel like midlife is sort of one of those times of life where, you kind of go into it, you don't really know what's happening. And so just trying to find your way. So I just, I wanted to start with kind of, your expertise and your background. And I love that you talk so much about regenerative medicine. This is so important, and it really as the future of aging. So for some women in midlife who are just hearing that term for the first time, can you talk a little bit about what regenerative medicine is?
Yeah, regenerative medicine basically just means using tools. There's various tools we could talk about, but getting your body to repair itself, to heal itself in sort of novel ways. So essentially, whether we send growth factors in from PRP or from stem cells or even like light therapy or other things like that, it's essentially getting your body to be like, oh, I actually need to start repairing this tissue and wake up and act like more youthful version of, myself.
And how does that differ from like what we've been taught, with health, especially with women's health? Like, how is that different from like our mom's generation or even our generation 10 years ago,
Well, we use regenerative medicine. It's most commonly used for like repairing, a hurt knee or a shoulder injury. Like musculoskeletal pain is where we start. This is where it started, is using like stem cell therapies and similar to repair muscle tissue, tendons, ligaments. But I've been using regenerative therapies for skin health, for scalp health, so to help regrow hair, for sexual health, and even for potentially kind of longevity purposes for the last 10 years. And it's all the same, we're using the same kind of technologies and biologics, but we're trying to kind of approach aging and healing in a different way.
I'm so glad you brought up sexual health because I think that that is such a topic that women don't feel comfortable talking about with their doctors, with even their friends, their partners. So I think that that is such an important thing to talk about. So as it relates to aging and clinical health, what are some ways that we can help improve our sexual health, and not feel so ashamed and like stigmatized about talking about it?
Yeah, I mean, I think sexual health is it's just like any other health, right? Like we should be able we go to the doctor, we have, my knee is not working properly and it's no big deal. But like we don't go to the doctor and say my clitoris or my vagina. Like we're very nervous about saying like this other area is not working properly. So part of it is just kind of getting over that. But I think of sexual health as being kind of I have kind of a four-pronged approach to sexual health. So the first one is mind the mind. So you always start with thinking about the brain, whether that's social relationships, that's your stress, that's your past trauma, like all the things that are in your head, because we know that your brain is your largest and most important sex organ. So start with there. So start with the mind, and the second part of it is boost blood flow. In blood flow to the sexual organs. We know in men it's super important for erections to have blood flow, and actually in men the most common cause of sexual dysfunction is lack of blood flow. But because we can see it, like that's what causes lack of erections. What's interesting is that in the women, that's probably also one of the most common causes of sexual dysfunction, but it's not talked about in women because it's harder to measure in women. So, but the blood flow is very important. So anything you can do to help with your cardiovascular health is going to be helping with your sexual health as well. Then the third piece of that is hormones. So making sure that your hormones are optimized. And then the fourth piece is the actual structures themselves and, making sure the pelvic floor muscles are appropriately tight and making sure that all the structures themselves, the vagina, the clitoris, et cetera, are all in working order, if you will.
So where should women, because that is like a very needed approach. We need to do all four of those things. What do you think is the most important place for a woman to start when it comes to sexual health?
I mean, I think it's very dependent on what's going on. Women's sexual health is extremely complicated. It's not just as easy as taking a Viagra and everything is perfect. So I think the first place to start, if you're by yourself, is to start thinking about easy things, or start thinking about how stress is affecting your sex life, how lack of sleep, how your lack of exercise, how the way that you feel about yourself. Some of these things are much more in our control than other things, but just keeping in mind that the daily practices like that can make a huge difference in how, whether or not you have a libido or not, or how your arousal is coming across.
What do you think is the most misunderstood thing about women's libido? Like, is there like a certain, almost like a myth buster,
I think I think people think that women don't have as much libido as men. Like we're not as interested in sex as men. And that is true sometimes. And certainly it waxes and wanes throughout our lives. I think that it's totally normal to have some periods where we're not interested in sex and some periods where we're much more interested, and it kind of comes and goes. But I think that women do get this, they get kind of a bad rap as like, we're not really that interested in sex. But I think that's not true a lot of times.
Yeah, and I think it's like you're saying, it's a multifaceted approach, and I love your idea of like treating the body holistically as it relates to sexual health, because it is so important to kind of prioritize yourself, take care of your fitness and your wellness, while also, just like really looking at your body as a whole.
Yeah, I mean, we know that there's a very close relationship between sexual health and longevity, and that like there was actually a study in 2020 in the Journal of Sexual Medicine that was like 15,000 men and women, and they found that people who had sex at least once a week had a 50% lower all-cause mortality rate compared to people who were not having sex. So they were half as likely to die. And it doesn't mean that sex makes you live longer, but it does mean that there's a close correlation between having an active, healthy sex life and being healthy in general, both from an emotional, mental, physical standpoint. So essentially, sexual activity can sometimes be an indicator. Like if you're having sexual problems, it can be an indicator that something else is going on in your health.
It sounds like it really just also helps like quality of life, like your enjoyment and your pleasure. And, I feel like a lot of women, especially at this time, have just lost that mojo, kind of like lost themselves a bit. They're kind of, maybe they're dealing with some aging parents, maybe they're dealing with kids going away and being empty nesters and
Yeah.
reconnecting with their partners. I mean, is that like, what would you say to a woman like that who just feels lost, like she's lost her sexual mojo?
I mean, I feel like we've all been there, right?
Right.
Like it's a hard time. It's a tumultuous time, whatever that word is. It is a hard time to be a woman. Like, and I think a lot of us have had partners for 15, 20 plus years. So there's also that part of it. Like maybe there's some boredom in there. We have kids that are getting older and going to college. Like that's stressful. We have aging parents. That's stressful. Our hormones are crazy. That's stressful. Our bodies are changing. So I think, give yourself a little bit of grace, but if you're interested in maintaining, sexual vitality and sexual activity, just know that there are a lot of things that can be done, both from a psychological, emotional, mental standpoint, but also from a physical standpoint.
And I love this too, what you said about aging kind of being optional, So, what do you think are some of the biggest needle movers to help women, especially in midlife and on a cellular level, reach their full potential for longevity?
I mean, there's so many needle movers. I think certainly hormones. I mean, I talk about hormones all the time, and I'm a big fan of estrogen and testosterone and progesterone. And I think all women should at least have that discussion with their doctors about the possibility of taking hormones, whether they choose to or not. That's up to them. But I think hormones are key. But other things like mitochondrial health is super important for overall health. And actually, the mitochondria are the little powerhouses of your cells, right? They make your cellular energy. And starting at about age 25 or 30, every year we lose about 1% of mitochondrial function. And mitochondrial function goes down significantly when we lose estrogen. So estrogen and mitochondria are like BFFs. And so when you lose estrogen at late perimenopause, menopause, mitochondrial health suffers significantly, and all of a sudden you're much more tired. You can't get things done. You're wired and tired, maybe. But so working on mitochondrial health specifically, I think is a key part of health that most doctors don't even talk about.
So, how do we analyze that in ourselves? Like, how do we find out if our mitochondrial health is optimal, even?
There aren't a lot of great tests. There are a couple of advanced lab tests out there that can look at mitochondrial function if you have like a functional health doctor, but there really aren't that many tests. You kind of have to go by symptoms, and also probably just know that if you are in midlife, you probably don't have peak mitochondrial health unless you're doing everything right. So certainly a healthy lifestyle, getting enough sleep, working on stress management, exercising like high intensity interval training can be helpful. Maybe even a little bit of intermittent fasting to give mitochondria a break can be helpful. There's a whole number of supplements that can kind of support mitochondrial health as well, including things like ketones, like exogenous ketones that you can drink, which are great because it's like an alternate fuel source for your body and gives your mitochondria a little break. So there's a lot of different strategies that we can use, but you kind of have to work with someone who understands, what this is.
Absolutely. And I'm glad you brought up the hormones too, because I think that that is obviously such a hot button topic right now. Recently it's the FDA approved like vaginal estrogen and said it was, of course, safe and everything, which is a change from what was told to us, 20 years ago. So for the women though, I mean, I know there is a small population of women who actually can't take hormones. What
Yeah.
would you say to them? Like, are there natural resources or supplements or things like that that they can take?
I mean, I think that hormones are a piece of the puzzle. They are not the entire puzzle. And certainly if you can't take hormones because you've had breast cancer, for instance, which is the most common reason that women can't take them, then you just want to understand what those hormones would be doing in your body. And then you can start to kind of replace that in terms of your lifestyle or your food or your supplements. So for example, loss of estrogen at menopause is a major driver of bone loss and osteoporosis because estrogen, keeps your bones healthy. And we know that. So if you know this is coming and your bones are going to start becoming less healthy because you're losing estrogen, then you have to be very strategic about keeping your bones healthy with weight training, with heavy lifting, resistance training, with like jumping exercises. So you have some high impact on your joints, with the appropriate nutrition, with supplements like vitamin D and vitamin K and magnesium and some of these things. And sort of essentially taking bone health and like making it one of your like part-time jobs because you don't have the help of estrogen. You have to do it yourself.
And are you concerned at all about the heart too, like with heart health and loss of it? Is that
Absolutely. Yeah, absolutely.
what would you recommend for that?
Heart attacks are the number one killer of women. So one in every three women will die of a heart attack or a heart related illness. So it is absolutely, and we know estrogen is very cardioprotective. So, again, like taking cardiac health very seriously, looking at your blood pressure, and all of these things, traditional medicine has kind of a cutoff of what's considered too high or abnormal. But there's also like this whole range below that that's maybe not like too high, but it's still like not optimal, right? So understanding what is the optimal blood pressure, what is the optimal blood sugar. Like maybe you aren't diabetic, but you also don't want to be pre-diabetic. You want to be like optimal. You want to be way down here for blood sugar. Same thing for cholesterol, keeping your cholesterol like your cholesterol low, your LDL-C, your ApoB. But essentially like understanding what are the drivers of heart disease and then going like hog wild in terms of making sure that you don't have those things so that you don't develop heart disease.
That's such a great point. When I opened up my DMs, one of the questions that I asked was about three specific things. It was about peptides, PRPs, and exosomes. And I know you are on the forefront of all of those things. So
Yes.
before we start diving into each one of those, in 5 years, what do you think of those three, or maybe even all of them, will be the most mainstream thing, like the go-to for women?
Mm. I love that question. I don't think PRP has been around forever. And I don't think it's going to be, that's just essentially you take your blood, we spin it, we get your platelets, and we put that back, in some part of your body to help repair. It's a great therapy. I just don't think that it is going to be the next generation thing. Certainly stem cell therapies, including exosomes. Exosomes, if you don't know, essentially stem cells, the way that they communicate with each other and with other cells is they release these little bubbles of information that are called exosomes. And within those, you have like growth factors and messenger RNA and cytokines and all these like things that tell other cells what to do. And so you could actually, we have products that we could just use the exosomes, or we can also use the entire stem cell depending on what we're doing. But they're both really great ways to help repair. And there's new versions of these stem cell therapies coming out all the time, like that are more specific for, like for instance, if we wanted to inject them into your scalp to regrow hair, there are new versions coming out that are specific for hair regrowth. Or for repairing a knee or whatever. So we're getting better and better at that. And so I think in the future we'll have many more of these products that are approved and that can be used even by like your general doctor.
Okay. Are we ready to take the deep dive? Here we go. What is an exosome exactly for the women who maybe have never heard of this, or maybe you're starting to see it more in skincare, I'd say, you see exosomes or you do it maybe after some plastic surgery or some treatments. But for like those women that are not so familiar with the exosomes, how can exosomes help them?
So exosomes, like I said, they're basically these messenger bubbles that come from stem cells. So when we give, for instance, if I was to give you stem cells into your face, if I injected your face with stem cells, which is something I do, the way that those stem cells work is they release these exosomes and other growth factors, and then those things kind of float around, and then they get captured by the cells in your face, and those exosomes get internalized, and then those exosomes change the way that your cell behaves. So for instance, if I want your fibroblasts in your skin to make more collagen and elastin to give your face, better health and structure, then theoretically we could give you exosomes directly. And that's it's like a blueprint that's being transferred to the cell, but it doesn't have any DNA in it. It's got just growth factors. So essentially it's a way to communicate that we want to increase healing, increase regeneration, but you're using your own body to do that.
Okay. And for exosomes, that's primarily for skin, correct? Like skin and face and.
Exosomes are not FDA approved for anything, but they are allowed to be used topically. So that's why we see them so much, like after microneedling of the face or after microneedling of the scalp. So they are used other ways. Certainly they're around, but that they're approved mostly just for aesthetics.
Okay. Now, peptides. This is like the hot topic right now. They're so having a moment. It's like, I feel like I look on social media and I see peptides here and peptides there. So Also, for women who may not be so aware of what peptides are, can you just kind of go through what they're used for and how they really help with regenerative treatments and health?
So peptides are just short proteins. So proteins are like these very long, complex amino acid chains, right? But peptides are a very short amino acid chains. Maybe they're 4 or 5 or 6 amino acids long. So they're very short. And so they each have and they come from like you have them within your own body. So essentially the ones that we use in practice are just taking what your body's already making, and we're just taking that and we're multiplying it essentially. So there's all different peptides. They do many different things. For example, one of the most common ones is BPC-157. That's the one that everyone hears about. Like it's the most common one. Normally in your body, it's found in your stomach juice. It's actually in your gastric juice, but it does a lot for healing the gut, for instance. It also does a lot for helping to repair and heal musculoskeletal pain. If you had a, rotator cuff injury or Achilles tendonitis or things like that, then that BPC-157 could potentially be helpful. The thing about peptides that you should know, however, is that most of these are not regulated by the FDA. Like they haven't gone through the FDA process to become full drugs, except for a few versions, like the GLP-1s, like semaglutide, tirzepatide. Those are peptides, but they've gone through the full FDA drug application process, right? So those are drugs, but there's a whole class of peptides that haven't gone through yet. So they're not as well studied. A lot of them are not even studied in humans. So we do have to be careful and say, these are still very much experimental, even though we think that they can help with a lot of things.
Absolutely. And for peptides, what is the best method of taking them? Like, is it the injections? Is it, I've even seen like GLP gummies and powders and things like that. What do you think is the best way to take these things?
I mean, most of them are going to be the best taken by injections, like little subcutaneous injections, like a little insulin needle, like in your stomach, for instance. There are some peptides that can be taken either like as a nasal spray or a sublingual, like underneath the tongue, or even a pill. Some of them, like the BPC, actually does survive through in the stomach. It does survive the stomach acid because it comes from stomach acid. So that one is one that's bioavailable orally, but most of them are going to be better. Have better bioavailability if they're injected.
Mhm. Okay, one of the questions that I got also was about tesamorelin. And tesamorelin, they wanted to know, is tesamorelin better than CJC? And what your thoughts were on that.
So tesamorelin and CJC 1295 are both examples of peptides that help to increase your own growth hormone production. And they are used, tesamorelin is actually FDA approved. It is a drug. CJC 1295 is not. That one is commonly used with something called ipamorelin. But basically, long story short, I prefer tesamorelin. It's better, but it's also a lot more expensive. So it's one of those things that you have to kind of decide how much you can afford, kind of thing.
And do they both sort of target weight loss and muscle building and things like that?
They increase your body's ability to make growth hormone. So you're making it yourself. And so it works better, people who are generally a little bit younger, not in your 70s or 80s. But yeah, you're increasing growth hormone, which growth hormone is important for everything from muscle building to, potentially weight loss to, your joint health to brain health. I mean, it spans all the systems in the body. Sometimes we'll use it, for instance, with people, if they're using GLP-1 medications, they're using like Ozempic and they're losing weight, but we want to make sure that they're also maintaining a little bit of muscle. So sometimes we'll add like one of these growth hormone peptides to try to help them maintain muscle, because they're as they're also lifting weights and doing all the lifestyle things, because we don't want them to get skinny but not have muscle.
Mm-hmm. Good point. Also, we're hearing a lot about NAD and NAD plus injections. So what are your thoughts on that? Do you think that is an effective treatment to take?
I've had a lot of back and forth on this. I actually, I have a supplement company for women called Hotbox, and we chose to put a precursor to NAD in there called NR, which is nicotinamide riboside. And the reason we chose that one is because it actually crosses the cell membrane and gets into the cell much easier than either NAD itself, which doesn't do that, or NMN, which is the other one. So I think that NR, just taken as a daily supplement orally, is better than doing IV NAD or even NAD injections, because NAD is a big molecule. It's not able to get into the cells into the mitochondria like we wanted to as that big chunky molecule.
Oh, interesting. So are we wasting our money if we're buying NAD supplements without the NR?
In the studies that have been done looking at NAD IV, for instance, what they found is the NAD, it does eventually get broken down into components that can be transported into the cell and used. So I wouldn't say necessarily you're wasting your money. However, instead of having to take something that gets broken down and transported, it's why don't you just take the thing that's already broken down? Like you're essentially like NR, you're skipping the step of having to break something down. It just goes straight into the cells, and you can take it in a daily supplement like in Hotbox, and you get your levels up, they stay up, and you don't have to, spend $1,000 on an IV.
Good point. We like that.
Yeah.
Also needles, I mean, who likes a needle?
I don't like a needle.
Same. So who is a good candidate for peptides? Is there like a certain age bracket or maybe body composition? What are your thoughts on that? Like, how do you know if peptides would be good for you or not good for you?
There are there are hundreds of peptides, probably about 20, 25 that are commonly used. But there's peptides for sleep. There's peptides for sexual health. There's peptides for healing musculoskeletal injuries. There's peptides for skin, for hair. It's for immune function and helping to fight illnesses. So there's peptides that for all different things. So I think, most people are candidates. We don't tend to give peptides to people. Certainly, if you're pregnant, we don't give you anything experimental because it just hasn't been studied. If you have active cancer, we're not giving you anything experimental. So there are people who we don't give, we just say, this is not a good choice for you. But other than that, most of them we think are pretty safe because they all come from your body. But they also, you do want to have a medical practitioner who knows about peptides. Like I do not recommend just going onto the internet and buying research peptides and, injecting them into your body. I think that's probably not a good idea.
That's a good point. Is there like an age where it sort of tops off? Like it stops maybe at a certain, maybe 70 or something, or can you take it throughout your whole life?
As far as we know, you can take it throughout your life. I haven't had any people in their like 80s or so that are on a lot of peptides. Most of the time, that's just not something that they're interested in doing. But as far as we know, that they can be used forever. It depends on again what the peptide is trying to do in your body and whether or not it's going to make sense with your body.
Absolutely. And, we were talking a little bit earlier about PRP. And I think sometimes when people think PRP, they're thinking the vampire facial, for example, and so that's kind of where the knowledge stops. But PRP is actually used for a lot more than just something like that. So are you a fan of PRP, and what would you recommend PRP for in midlife women?
Yeah, PRP is when you think about the regenerative biologics, so things that are biologic that we inject. PRP is kind of one of the most used one. It's been around for decades. It's super safe. It just comes from your own blood, and it's just platelets from your own blood that we re-inject. So PRP is great, but you do generally need a few treatments. So like if you're doing it for your scalp, you need at least 3 treatments. If you're doing it for your face, you generally want to do about 2 or 3 treatments. Same thing for your knee. So it's a good therapy. It's very safe. It's not as strong as like the next level up, which would be probably stem cells or exosomes or some of these other kind of higher level regenerative therapies where they're going to be more expensive, but they also generally have better outcomes with a single treatment versus PRP. But they're all kind of the same. They all work in a similar way.
So PRP is relatively safe for most people?
Yeah. Oh, yeah. PRP is extremely safe. The only potentially dangerous part are the injections. So, you could get a joint injection infection in your knee if someone used a dirty needle, or if you had, there's some technique things like that. But the PRP itself is extremely safe.
Hormone optimization is so important in your practice and what you talk about. So what are the signs that women should look for to see if their hormones are off, and how should they be reevaluating their own lives to make sure that hormone optimization is there?
Well, I think all women should be getting, basic hormone testing at least once a year. And that's like thyroid. That's, if you're over 35 or so, probably testosterone, cortisol, if there's any concerns. Like there's some hormones like insulin, things like that you should be getting every year. And then as you get into perimenopause, which is, can happen in the 5 to 10 years before menopause, so often starts as early as 35 or so, then having a physician who understands the symptoms to look for, because there's 30 plus symptoms in perimenopause that could stem from progesterone going down and testosterone going down and estrogen going down. And then eventually menopause, you don't have to necessarily check labs like estrogen and progesterone to know that they're low, but I do recommend checking them at some point, especially if you're going to start therapy.
I think it's interesting too. A lot of women, when they go to their doctors and they say, I feel off, or, I feel like my levels aren't quite right. A lot of them are gaslit by their doctors and said, you know what, if you're still having your period, you're fine. Come back and talk to me when you miss a year's worth of a period. And so I think a lot of women are, unsure what to do. So what advice would you give women in sort of that situation that feel like they're being gaslit by their doctor?
Yeah, I mean, unfortunately, doctors just don't receive training or, very much training at all in any of this stuff. Even the gynecologists, even the endocrinologists, like these are great doctors and they know a lot, but the training on how to care for a woman in perimenopause and menopause and how to use and how to optimize hormones, across all ages is really not taught. And I think it's really a matter of, we need to give more education for doctors. Like I'm working on a course right now for doctors for that same reason. But I guess you just kind of do keep asking. And also if your doctor is not familiar with how to treat this or, understand how to even diagnose problems, you may have to find a new doctor. Like that's unfortunately, your doctor may not be able to be educated quickly enough for your needs.
Is there an age that is too young to start getting a baseline test for your hormones? Or is that somebody women in their 20s should be doing?
Well, it depends on what hormones you're talking about. If you're talking about like things like thyroid, your insulin, these hormones, you should be checking every year as an adult. Like every year you should have those checked. If you're talking about things like estrogen and progesterone, then it is true that if you're having really normal cycles and aren't having any problems, you probably don't need to check those labs. Like if you're 25, 30 years old and you don't have any cycle problems or everything is pretty fine, then your hormones are probably fine. If, however, you are 25 or 30 years old and you have irregular cycles or no cycles, or you're skipping several months at a time, or you're having like severe bleeding or pain or all those kinds of symptoms, then absolutely you should get your estrogen, your progesterone, your testosterone, like your FSH, your LH, all these hormones should be checked. And there is a right time to check the hormones. There's a right way to look at, like, it's not something as easy as just like, what's the normal, like what's the optimal level, because it's, they're changing every day, right, during your cycle. So you need to have a doctor who understands when to check the hormones. What are the optimal levels? What's too high? What's too low? What else to look out for? It's complicated.
Right. And it's holistic, right? It's like the whole body, because if something, you have inflammation, maybe that ties in, right? There's just so many moving parts, right?
100%. Like, you could be having, irregular periods because you are stressed out and you're not making, you're not ovulating properly because you're stressed, and then your progesterone's not high enough. And so now you're having insomnia and worsening stress. Like it is a complex system. And so you do have to think of it, like you said, like holistically, not just, how are your ovaries doing?
Absolutely. So let's talk skin, because, we like to look good. Let's be honest, So I love that you are, preventative in that way, especially with the regenerative health. And so we want to talk about interventions that will make sense and help us. So what are the 3 things that you think women over 40 should stop wasting their time on as it relates to, having great skin, looking good, feeling youthful, all those things?
Ooh, that's a hard one. I think that most of I'm a fan of almost all of the different cosmetic interventions, whether it's something like microneedling or applying PRP afterwards, or just doing good skincare with sunblock and retinoids, which are fabulous. I do, there are some of the like the deeper treatments I'm not as big a fan. Like I don't think that the radiofrequency microneedling treatments are right for everyone. That's like the Morpheus and the things where it has the needles that heat up inside your skin. Those were all the rage for a while, but then people started noticing that was actually causing a lot of volume loss, like fat loss in the face, which makes you look older. And so, I think that there's a right way to do it, but I also think that there's a wrong way to do it. So, there's all these things kind of come in and out of vogue. But all of these treatments, these lasers, radiofrequency treatments, like ultrasound-based heating treatments like little therapy. All of them have a place, again, but with someone who knows how to use these tools.
So, okay, so you're not a big fan of Morpheus 8?
I've done a lot of it myself, but I do think it could be helpful at the less deep needle, levels, but I don't think it's a good idea to go deep in the skin if you have someone who is getting older. You don't want to lose fat in the face.
Okay, so that maybe you want to be very careful when you do that one. How about like Botox, fillers, that whole realm?
I actually think all of those things are great. Again, if done properly. I am not worried about Botox. I know that a lot of people have concerns that it's dangerous to your brain or things like that. But I mean, it's been, this is one of the most used, utilized, and studied, treatments that we've had for decades now. So I think it's fine. Certainly don't think you don't have to do it. I don't think any of us should feel pressure to do anything. But I think that Botox and these toxin treatments are appropriate in small doses. I think fillers could be great, fillers and Sculptra. But again, you have to you want your doctor to know what they're doing to be, because there are potential side effects that can be really dangerous if you get in the right hands.
Do you think we need to be worried about the migration of, we've heard like sometimes it can migrate in your face and things like that. Is that something to worry about?
I haven't seen a lot of migration. I do think that these fillers do stick around longer than we thought. We used to think that they would just stick around for 6 months to a year. But and I don't do facial surgery, but I just know that a lot of my surgery friends, when they're going in and doing facelifts or things like that later, they're finding filler in there that was there from 5 years ago. And so I do think they're lasting a lot longer than we think, and that and certainly at some point, it doesn't make sense just to keep adding more and more and more filler. At some point, if you want that look, you may just need to get a facelift.
Yeah, exactly. Just go for the big one.
Yeah. And I haven't had a facelift, but I've done filler, I've done Sculptra, I've done mini lasers, I've done toxin, I've done all of it on myself.
So for you, is Sculptra sort of the filler kind of thing that you liked the most?
I do like Sculptra. Sculptra is not, you're not filler. You're looking at like one area and you're kind of trying to, get that one area to be filled. Sculptra is more like you're looking at the whole face and you're doing little bits here and there. So they're different in how they work. And Sculptra is kind of getting your own body to create the collagen also. So they both have their place. The thing is, people always ask me like, what's the one thing I should do? There is no one thing. Like the one thing is sunblock, probably, if there's a one thing, and then maybe retinoids second. But after that, like it really depends on how old you are, your skin quality, your facial structure, your budget, your comfort level with trying new things. Like there's so many variables.
So many. Do we need to be worried that any of these treatments will affect our hormone health?
No,
okay.
Not that I know of.
Okay, so we're pretty safe on that end. I was watching one of your videos last week about alcohol, because that is something that we all feel nowadays. I feel like, whatever, going out, talking to the friends, doing like a girls' night, you have a couple glasses of wine and the next day you feel like you've been hit by a truck. I mean, it's just,
Yeah.
Remember like back in the day in your 20s, you'd have like 3 or 4 glasses of wine and you were fine the next day. Now it's a different story. So why is this happening? Is it just like that we just basically can't process it like we did before? Like, tell me like start to finish. Why is this happening?
There's a few reasons. One is, you can't process it the way you did. The alcohol dehydrogenase enzyme in your liver that metabolizes alcohol starts to slow down as you get older. And so your liver is literally able to process alcohol much slower. So it's staying in your body longer. Another thing that happens is as you get older, you're losing muscle, because that happens with age. And muscle carries a lot of water. So when you lose muscle, you actually start to become more dehydrated. And so you have a lower volume of water in your body. Estrogen also keeps you hydrated. So if you lose that, that's also making it worse. So you become more dehydrated and then you drink alcohol. And then so it's like essentially it's more concentrated in your bloodstream, because your bloodstream, you have less blood and less hydration in your blood. So that's happening. And then there's also a lot of things in your brain, the way that alcohol affects your neurotransmitters, your dopamine, things like that changes with age also, especially in midlife. And that's also makes it harder. And so it just becomes a lot worse for us.
It's true. You just feel terrible the next day, and I feel like a lot of women are really looking at that and saying, I want to cut back on alcohol or maybe only drink once a week as opposed to like 2 or 3 times a week. It's kind of implementing these lifestyle changes, right?
Yeah, I mean, a lot of women in midlife just decide to stop drinking. It's just not worth, it's not worth it anymore because our sleep is already disrupted. Like we're already waking up with potentially hot flashes or night sweats, or just waking up and can't go to sleep at 3 a.m. And then if you add alcohol to that, that's obviously going to make that worse. And so a lot of us are just like, that's not for me. I know I still drink a little bit here and there socially, but I definitely have cut back. I don't drink every day by any means. And when I do, it's always one drink because if I do more than one, I know it's not going to go well for me.
Right, right. Why is it the 3 a.m.? That's the time. Every time I had wine,
I
it's the
know.
3 a.m. wake up. Why?
I don't know why exactly. Alcohol is a depressant. So it makes you sleep, but because it also does interrupt your REM sleep. But I don't know why it is 3 a.m. for me as well.
It's true. It's always that time. Are there any things that we can take the next day to help us feel better if we do indulge a little too much?
And there are a lot of products out there that are like, the hangover kind of pill packs and, IVs and things like that. I don't know if they work or not. A lot of them target liver health and trying to get your liver to, work faster. I haven't seen if those things really work. Probably just hydrate, make sure that you're getting some good food in your body and maybe get some sunlight. Like that's what I'd recommend.
Yeah, it sounds like a good plan. Maybe head to the beach and, have some water, cool water on your skin. You see both men and women in your practice. So what are the things that you think that women over 40 are doing better than men as it relates to taking care of themselves and helping, with their health?
Ooh, that's a great question. I think that women especially now, are becoming more knowledgeable about perimenopause and menopause and these hormonal changes. So a trend I've seen now is women just asking a lot more detailed questions about their health than men. Like, men, a lot of them know about testosterone, but they haven't been, inundated with all this information that we're now seeing on social media for women. So I think a lot of them just don't understand other things they should be asking about, insulin sensitivity or thyroid function or, like muscle mass and visceral fat or things like that. But I feel like women are becoming more educated because of the great people that are out there, the doctors and the influencers and people who are talking about this so much now.
Absolutely. That's something we really want to do here on the show is like, knowledge is power. Like women should know these things and they should be armed with, all of this knowledge when they're going into their doctors or when they're even going out with their girlfriends, it's such a great time to talk.
Yeah, absolutely. And I think that women, we're all seeking answers. Like we're a lot more complicated than men for sure. Our hormones can go crazy in a lot of different ways, whereas men's usually it's just like a couple of ways. But luckily we also are more, we tend to talk more with our friends and to discuss, and we have the social component that I think is a little bit different than a lot of men.
Do the men also suffer from like hormone drops in their midlife? Do they kind of go through? Really?
Yeah. They do. Well, but in both men and women, testosterone starts going down, starting at about age 25 to 30, but it's like the slow, gradual descent. So testosterone in men and women is very different than estrogen and progesterone, which at menopause, kind of falls off a cliff. Like you go from like, it's fine to, oh my gosh, I'm out. Testosterone is a much slower decline, but it happens in both men and women. So men often about age 40 start feeling effects that are related to low testosterone. Not all men, but some men. So it's common for men in that age to come in and say, I just don't feel like myself these days.
Interesting. So how do we, for those of us that have partners who are men and going through midlife as well, like what are the things that we can do to kind of help them? Because, men tend to be more closed. They don't want to talk about it. It's almost like I have to force my husband to go to the doctor, So how can we support them during this time?
Well, I would recommend getting your testosterone checked. That's easy enough to do. Get a total and a free testosterone. There's a couple of other lab tests that we do at the same time that checks your pituitary gland function and things like that. But, get some lab tests done. But the good thing about testosterone, this is different than with women. There are a number of lifestyle changes that you can make to improve testosterone in men. So like lifting heavy weights, getting exercise, losing belly fat, reducing stress, making sure you have enough like of some of the micronutrients like selenium and zinc and vitamin D and things like that. So lifestyle changes actually can make a difference in men, especially younger men, and in helping their body to make more testosterone.
Mhm. So what do you think about this whole thought too about microdosing GLPs? Have you heard that? Like I've seen it on social media where women are like, I'm just microdosing just because, I'm in midlife and I feel like it's helping me. Is it helpful to do something like that? Or what do you think about that?
I think that we need to learn more about microdosing. And you're certainly, it's basically just any dosing that's outside of the normal parameters. It's lower than the normal FDA approved versions. But I do think that these medications are fabulous, and that there are a lot of indications for these medications outside of just weight loss that we're learning about every single day. So I have a lot of patients who are taking small doses, these microdoses, to try to help with things like inflammation or arthritis pain or polycystic ovarian syndrome or mast cell dysfunction or autoimmune disease. All these things that are these medications, Ozempic, et cetera, are helpful at, but we don't have the data to say what the dose is yet, or exactly how helpful they are at those baby doses.
What is the one thing that you wish all midlife women knew about their health?
I think the most important thing for women is to know that you have a lot of control of your health, but also you don't have all the control, and you oftentimes need to get a kind of a co-pilot, medical provider who can help you with the pieces that you can't control. So a healthy lifestyle is absolutely important. It goes a long way to staying healthy and feeling good, but it is not necessarily going to mean that you don't have perimenopausal symptoms or menopausal symptoms. Like, it does not go all the way. So yes, you have a lot of control, but also find that person that can help you if you need it.
And what about the women who have had hysterectomies? Are they still going to, have menopausal symptoms and the hot flashes and the brain fog and all that kind of stuff?
Oh yes, when you have a surgical hysterectomy, you have your ovaries taken out. With ovaries taken out, you essentially go through an entire perimenopause in the course of like 24 hours. So essentially, you go from normal production to no hormone production, or very minimal, and so the symptoms can be very severe. And unfortunately, a lot of doctors, at least in the kind of old school doctors, weren't even replacing those hormones. Like even for, I've had young women who messaged me and said, I had a hysterectomy with my ovaries taken out at age 30, and no one told me that I should be on hormones. And like it's crazy. It's absolutely crazy.
That's insane. That is crazy. And what are like the 3 supplements that you think that every woman should have in her medicine cabinet, no matter what?
I love creatine. I love vitamin D3 with K2. I consider that to be just one thing, but it's actually 2 ingredients. And probably magnesium is the third thing I like.
Okay, yes. Magnesium is something we really lack, right?
Yeah, a lot of people lack it, and there's multiple different types of magnesium. My favorite is magnesium glycinate because it's just easily digested. It's great for sleep. It's great for kind of calming you. But there's many types of magnesium, but almost a lot of people are deficient within magnesium.
When we take vitamin, because you said D and K2, should we also be taking vitamin A and vitamin E with it? So it's like the 4 of them together, or do we just need the D and the K2 together?
You don't necessarily, yeah, those are all the fat soluble vitamins, and you certainly can take them together. Most of the formulations are going to be vitamin D3 and K2 together. And then you may have the other vitamins in like a multivitamin or something. I don't think the thing with vitamin D is we don't tend to get enough of it in our diets. And unless you're out in the sun, at least 10, 15, 20 minutes a day, you don't get it from the sun either. So women are oftentimes deficient in vitamin D for that reason. We're inside too much, we're on our computers too much. So, a lot of the vitamins you can get in your food. If you have a healthy diet, you don't need to necessarily take a multivitamin. Although obviously our diets are a little bit different than they used to be, and the food sources aren't quite as quality as they used to be.
Mm-hmm, absolutely. Should we be eating all organic?
That's an interesting question. I think that the jury is still out, and I'm sure that people in the wellness world would want to hang me for this. But I think that there are certainly foods that are going to be better organic. The people all the dirty dozen foods, the ones that are on the list that have like the thin skin, like apples and things that have a thin skin. Organic is probably better. But the thing is, though, organic foods oftentimes they're using, whether it's pesticides or versions of pesticides, that are, because they still have to keep the bugs away. And so they're sometimes using less regulated pesticides or alternatives than, the sort of other crop, manufacturers. And so I don't necessarily think that organic is always healthier, although certainly in some cases it probably is.
And with the meats and everything, do you think it's best to go organic?
With meats, I recommend, if you can afford it, to do like, the grass-fed or pasture-raised and free range. Obviously the sustainably raised agriculture is going to be better for the environment and probably healthier as well. Unfortunately, those also cost quite a bit more. So you kind of have to balance, like, what can your budget afford with what's the healthiest.
Absolutely. So what advice would you give your 25-year-old self?
Ooh, that's a great question. I think that I would tell myself just to hang on, and it's just gonna get super fun. Like, I feel like I'm having such a good time. I'm 49. Certainly there's hard days, but I also I love this phase of life. I think it's as challenging as it is. I also feel like it's very empowering, and I love the person that I am trying to become. I don't necessarily love who I am all the time, but I like this journey a lot.
Yeah, what is the best part of midlife for you right now?
I feel like I'm just stretching myself a lot. Like, I have several companies. I do a lot of social media. I do a lot of teaching. I'm getting to do all the things that I like to do. Like, I used to be an ER doctor, which was fun for a little while, but then I left, and I had no idea what I was going to do for my profession, for my job. I had no income, for a while. And so it's just fun for me. I'm getting to create exactly what I want to, even though it's a lot of work. I just love this field of medicine so much.
It is. It's an exciting field. There's so many developments and changes and things like that. How are you living iconically right now?
Iconically? Oh, my goodness. I don't know. I don't know if I'm living iconically.
You are.
I don't know if I am. I don't know if I am, but I do try. I try to have fun. One of my biggest beliefs is, like, in terms of whether it's the way we live or the way we educate other people, is to bring a playfulness and a funness to it. I feel like that's lacking in a lot of in healthcare, in wellness. Like, the play part of it, I think, is so important. So I think one of my I don't know if it's a gift or if it's just something that I've kind of forced on the world, is that I try to bring that fun to my teachings, to the things I'm doing, to my teams. So hopefully that's something.
It is. It makes it more digestible for people too. They're having fun with it, like you're saying, and smiling and having a good time. So on the Iconic Midlife, we like to wrap up the show with a game. Are you down?
Oh, okay. I'm ready.
All right. So it's a rapid fire game, and it's going to be called Science or Snake Oil.
Ooh,
so basically, okay, I'll kind of name a hot button topic or a buzzword, and you let me know what you think. If it's, grounded in research and worth like doing, or snake oil, meaning like we should just pass.
Okay. I'm ready.
Perfect. Okay. Collagen powders and drinks.
Snake oil for skin, science for bones and joints.
Really? So there is a difference.
Yeah, I just wrote a Substack on this and went into all the studies. So yeah, check out my Substack, and I went into it pretty deep.
Okay, good to know. Ozone therapy for anything.
I would say to be determined.
Mm.
I mean, I think that there is some good science out there. I'm not sure we know quite how to harness it best, but I do think it's a maybe.
Okay, a maybe. NAD plus IV drips.
I don't like them as much as I like the pills. I like the NR pills better than NAD IV.
Oh, really? So you think the pills are more effective, or?
I just think that it's a less expensive, easier way to get the NAD that you're wanting to get.
Okay, good to know. Red light masks for anti-aging.
Science, as long as it is a good quality mask.
Okay. Semaglutide for biohacking, aging, and not weight loss.
Science.
Okay. Hormone pellets for everyone.
It's snake oil for everyone. However, I don't think that they're always bad. I think that pellets they do have uses. There are people who do great on them. I think the idea that nobody should have pellets is silly.
Okay. Do you prefer various methods of like the hormone delivery system? Is there one that you think is more universal maybe for people, or is it just totally individual?
It depends on the hormone. Like, for estrogen, I like transdermal. I also like oral. For testosterone, I like injections or transdermal. Progesterone, I like oral or vaginal.
Oh, okay. Good to know. Suppository vitamins and vaginal detox pearls.
Snake oil.
Okay. Oh yeah. What do you think about the egg, right? There's like the egg that you,
The jade
yes,
egg.
the jade
Yeah.
egg. That's right.
I mean, it's just silly. It's just a marketing propaganda.
Okay. Good to know. IV glutathione for skin health.
I don't know specifically for skin. I do think that glutathione is important. I don't, and again, I haven't seen. I guess it's kind of middle. I haven't seen a lot of studies on IV glutathione, but we do know it's important in our bodies for many parts of detoxification and things like that. So I'm not sure.
Okay. Vaginal steaming.
Snake oil.
Good. One less thing to have to worry about. Okay. Cold plunges for hormone health.
I would say snake oil for hormones, but I do like cold plunges for recovery from workouts, reducing muscle soreness, and for stress relief and kind of neurologic stress adaptation.
Okay, so you do like it for women, because I've also kind of heard maybe it's more effective for men just because of their makeup. What do you think about that?
Yeah, I just actually am working on a Substack on this too. That we don't actually, so most of the studies have been done in men. We have a lot more data on men than we do women, but we don't really have good evidence that they're problematic for women. In both men and women, the cold plunges should be a little warmer than we thought. They should be between 50 and 60 degrees, and you should be going between around 10 minutes. So it's a little warmer and a little longer than we thought is probably ideal for both men and women. But I do think that women can certainly do cold plunges, just understanding, listen to your body, da 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 da.
Okay. And should we be doing it at a certain frequency, or like once a week or more?
It's usually about 2 to 3 days a week is probably about right. You don't want to do it necessarily every day because you get habituated to it. But if you 2 or 3 times a week, if you want to do it ideally within an hour of like a aerobic exercise, like if you go out and run a long time, you want to do that within an hour. You don't want to do it after strength training exercises because that will actually blunt muscle growth. So you want to wait at least 4 hours after your weight training exercise to do any kind of cold water.
So if we do the heavy strength training, should we be going in like an infrared sauna after that? Like it's like the opposite, or just...
You can, yeah, you certainly can. You can do sauna. Sauna is fine anytime, but the cold water, if you want to do it before your weight training workout, or just do it like the next day.
Oh my God, so much good knowledge. Okay, now I'm like planning it out already for the rest of the week. Okay.
And check out my Substack, subscribe. I'm going to have a great article on that coming out.
Oh my gosh, absolutely. And last one, second to last one, celebrity endorsed wellness brands.
I think it's probably hit or miss on the celebrity and what the brand is. There's a lot of fluff out there for sure, but I think there's probably some good ones in there as well.
Okay. And fill in the blank on this one. Optimizing midlife isn't about perfection. It's about
consistency.
So doing a little bit of something every day.
Yeah. You don't have to go hard every day. You just got to go.
Yeah, exactly. Make that move. So how many times a week should we be doing the heavy lifting?
I would say at least 3 days a week is appropriate, 3 to 5, depending on the person. But I would say, again, if you can get 3 to 4 good lifting days in there, that's great.
Okay, good to know. And cardio?
Cardio, there's 2 different kind of types. There's the lower key, like zone 2, which is like going for a fast walk or, things like that. I think you should try to get some of that most days. And then the sort of sprinting and high intensity intervals that at least twice a week I like.
Well, thank you so much, Amy. It's been such a pleasure. You gave us so much amazing knowledge. No doubt this is going to resonate with women everywhere. Do you mind telling everybody where they can find you and anything you want them to keep their eye out for?
Okay, so it's Dr. Amy B. Killen on Instagram. And then dramykillen.com is my website. And then I also have my supplement company, Hotbox, is hotbox.life as well.
Well, thank you so much. I really appreciate it. The name is perfect for this time of life right now. I feel like I'm in a hot box most days.
Yeah.
That was Dr. Amy Killen. And if you're feeling a little more powerful, a little more informed, and a lot more curious right now, then good. That's the point. Because your hormones, your libido, your skin, your energy, none of it is just in your head. And midlife isn't something to fix, it's something to optimize. You can follow Dr. Killen at Dr. Amy B. Killen and check the show notes for links to her clinical work, programs, and everything she's exploring in the world of regenerative medicine. If this episode gave you clarity, confidence, or even just the language to ask better questions, send it to a friend and tag us on social media and let us know what resonated. Follow, rate, and comment on Apple Podcasts, Spotify, Amazon Music, or wherever you get your podcasts. It helps the Iconic Midlife reach more women who are ready to feel powerful in their own skin. Follow the show, share the knowledge, and remember, midlife doesn't mean invisible. It means unstoppable.